Hello everyone. Today, we're going to discuss a medication called Hydralazine, commonly known by its brand name, Apresoline. As always, this discussion is intended for educational purposes. If you have health-related questions or concerns, be sure to reach out to a medical professional. Description: Hydralazine, sold under the brand name Apresoline, is an oral and injectable medication that belongs to the class of drugs known as vasodilators. Its primary function is to relax the blood vessels, which helps to lower blood pressure and allows blood to flow more easily through the body. Hydralazine is primarily prescribed for managing high blood pressure, hypertension. It is also used to treat heart failure in combination with other medications. Hydralazine works by directly relaxing the muscles in the walls of the blood vessels, which results in their dilation. This dilation decreases the resistance that the heart must overcome to pump blood, thereby lowering blood pressure and reducing the workload on the heart. Warnings: Hydralazine comes with several precautions. It should not be used in individuals who are allergic to the medication or its components. Additionally, it is not recommended for patients with certain cardiovascular conditions, such as coronary artery disease or rheumatic heart disease affecting the mitral valve, due to the potential risk of exacerbating these conditions. Those with severe kidney impairment or systemic lupus erythematosus, SLE, should also exercise caution when taking this medication. Before taking this medicine. Before starting Hydralazine, it is important to consider several factors. You should inform your healthcare provider if you have a history of heart disease, kidney disease, or lupus. Additionally, if you are pregnant, planning to become pregnant, or breastfeeding, you should discuss the potential risks and benefits with your doctor. It is also essential to inform your healthcare provider about any other medications, supplements, or herbal products you are currently taking to avoid potential interactions. Side effects: all medications can have side effects, and Hydralazine is no exception. Some common side effects include headaches, dizziness, and a rapid heart rate, tachycardia. Some individuals may also experience gastrointestinal symptoms such as nausea, vomiting, or diarrhea. In rare cases, Hydralazine can cause a condition known as drug-induced lupus erythematosus, which is characterized by symptoms such as fever, joint pain, and muscle pain. If you experience any unusual symptoms or signs of an allergic reaction, such as rash, itching, or swelling, you should contact your doctor immediately. More serious side effects include severe low blood pressure, hypotension, which can cause symptoms such as extreme dizziness, fainting, and blurred vision. There is also a risk of developing a condition called peripheral neuritis, which is characterized by numbness, tingling, and pain in the hands and feet. If you notice any of these symptoms, it's crucial to seek medical attention promptly. Interactions: Hydralazine may interact with other medications, which can affect its efficacy and increase the risk of side effects. It is important to inform your healthcare provider about all the medications you are taking, including prescription drugs, over-the-counter medications, vitamins, and herbal supplements. Specifically, you should mention if you are taking any other blood pressure medications, as the combination can lead to an excessive drop in blood pressure. Dosage: the correct dosage of Hydralazine is vital for its effectiveness and safety. Always follow your doctor's recommendations when taking this medication. The typical starting dose for adults with hypertension is 10 mg taken 4 times daily for the first 2 to 4 days. Your doctor may gradually increase the dose based on your response to the medication. The maintenance dose usually ranges from 25 mg to 50 mg taken 4 times daily. For heart failure, the dosage may vary, and it is often used in combination with other medications. It's important to take Hydralazine exactly as prescribed and not to alter the dosage without consulting your healthcare provider. Avoid: while taking Hydralazine, it is advisable to avoid activities that require alertness, such as driving or operating heavy machinery, until you know how the medication affects you. This is because Hydralazine can cause dizziness, especially when you first start taking it or when your dose is increased. Additionally, it's important to avoid alcohol, as it can enhance the blood pressure-lowering effects of Hydralazine and increase the risk of side effects. FAQ: many people have questions about the use of Hydralazine in different populations. Currently, the safety and effectiveness of Hydralazine in individuals younger than 18 years old have not been well established. If you have specific questions or concerns about this medication, it's best to consult with a healthcare provider. Closing: that concludes our overview of Hydralazine. Remember, this information is meant to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.